So Stephanie gave us a kickstart with rugby. I'm hoping that by the end of this Talanoa, we will have scored a try. And on that note, I want to acknowledge the 100th anniversary of the Pacific Nations Cup. Fiji, Tonga, and Samoa have been playing rugby for 100 years. And today, the Fiji rugby team heads to Tonga for their next match in the Pacific Nations Cup. So go Samoa! They beat Tonga last week. So in this Talanoa, I want to give you a little snapshot of Pacific peoples, the work we've done with them and the approaches we've applied. The principles of engagement with Pacific peoples is very important, and also the partnerships we form with them through our research, and may it continue. But let's begin. 19 years ago in 2005, when I transitioned from the private sector into academia, I was interviewed by Dr. David Scharf here, who's in the center of this photograph, and Professor Robert Scragg on the second to your right. And I got the job. Managing the baseline data collection for the obesity prevention in communities study. It was a 4-country regional study involving Australia, New Zealand, Tonga, and Fiji. And my role was to manage the New Zealand arm of this study. And oh, what an exciting time. I was so happy to be involved with this team, my first research team under the guidance of Robert Scragg, and a team of early career researchers. Today, they are senior professors at the University of Auckland. One is in New York, another in Queensland, and I'm here in the Langimalie Research Centre. But I must acknowledge one of our colleagues seated at the front, right-hand side, who recently passed away, Dr. Tasameta Te'evale. Was a senior academic at the University of Otago at the time of her passing. And so my journey begins from 2005, but prior to the private sector, I was in the international sector with the UN Development Programme, and before that, in the public service with the Fiji government. And here, one of the challenges we have, but great opportunity, is the rich diversity we have in our communities. And here is an image of Tokelau participants that took part in the life course research study with Compass and supported by our 3 health-related national science challenges. Why Tokelau? Well, these are one of the voices that we rarely hear of. As I mentioned earlier, it was some 50 years ago when the late Dr. Ian Pryor conducted that famous epidemiological study with them. And some of those participants took part in this group. But I want to mention one thing, is that when I submitted our application for this study, one of the reviewers said, "Oh, Offa has no connection with Tokelau people. The community doesn't know her." Well, when I got that feedback, it gave me all the more reason to stand up for Tokelau and say, let's do it. We eventually got funded, and guess what? When I started to meet with the community, I learned that my great-grandfather came from Tokelau. I only knew that my grandfather was from Tuvalu. And on my mother's side, and grandfather from Rotuma on my father's side. But here we go. I had ethnic connection to Tokelau, born in Fiji, mother's part Tongan, Tuvalu, Tokelau, and father full Rotuma. And so that's one of the challenges of our Pacific communities, and the opportunity for all researchers not to be afraid to engage with us, because Pacific peoples are welcoming. They want to be involved in the research. They want their voices to be heard. And it's been a joy articulating the voice of our Tokelau people. And so hopefully there will be tips and some takeaway messages for you in engaging with communities. And what's very important is the relationships we establish with them. No relationships with Tokelau until you connect with them and meet with them. And so an opportunity here is, and we'll come to it in my very last slide, I think, is why it's important to connect with other researchers who have links to the different Pacific communities and in the different areas of interest that we work with. So Pacific have different research models that we can apply in our work, specific models to the different ethnic groups. For example, Tivaiwai model for Cook Island people, Vanua for Fiji communities, Kakala model for Tonga, Whanofale model for Samoa, and it's how we take the richness of those different models and weave it into our conversations, data collection, and how we use them to interpret the information we gather from our participants. Along all those different models are principles of engagements. And yes, you mentioned relationships. That is very, very important. And building trust with the communities, because it's a two-way process where both sides need to earn the trust of each other, maintain those connections, because the opportunity for us is to ensure that our work is authentic, that it is believable, where there are gaps, that we are not afraid to identify those gaps because our communities rely on us, and to take them along on the journey too, so that it's not just us presenting the results of the study, but giving them the opportunity to speak for themselves about their experiences. And apart from doing the research, it's also important for us researchers to provide a governance role to other colleagues. And here I share an image of the Pacific Governance Group to Nikki Morland at the University of Auckland, where Nikki and her team are developing a strep A vaccine. And why this is important to Pacific communities when they hear about the work that Nikki and the team are doing, that they can see the relevance and why this relates to them. And so you might recognize some of the people in this image: Dr. Adam Edison, a pediatrician, Middlemore Hospital, I think, is that right? Okay. And Dr. Natalie Netzler, one of our early career researchers, virologist, doing amazing work in the community. And in the front beside Nikki is Dr. Florina Chan Mao of South Seas Healthcare, primary healthcare based here in South Auckland in Otara. And, providing, this is a Pacific team. Oh, one more member of our governance group is Dr. Sainimere Boladoa from Fiji, who is currently pursuing a doctoral degree at our School of Population Health, University of Auckland. And so it's not only about supporting our scientists, but also the early career researchers like Dr. Natalie Netzler, and also Zanetta To'omata, who has now submitted her doctoral thesis and has transitioned to the Broad Institute in Boston. And this is exciting to see how our early career researchers are given the opportunities to excel in what they do, and they can see for themselves a career pathway in scientific research. And Zanetta had the opportunity to understudy Barry on our brain health project. And that was exciting for her to be able to gain experience working with the IDI data and you know, these are stars amongst us that I am always excited to look out for, and you'll hear about more stars. We have one in here, Tamison, hiding in the back, and following me will be Malia, our research fellow. And this is why the engagement with our Pacific communities is very important to us. Here's an example of a Tokelauan man being given the opportunity to articulate his own voice and experience, and doing a video clip to share in his own language and information about making lures from mother of pearl shell. This was an experience that he grew up with in Tokelau and is able to continue today here in South Auckland, where he lives. We made this video last year and promoted it during Tokelau Language Week. And so, you know, another way we can build strong relationships and partnerships is with another team of scientific researchers from the Maurice Wilkins Centre for Molecular Biodiscovery. This is one of New Zealand's national centres of research excellence, and I'm excited that we can bring our Pacific team to work alongside some of our renowned scientists, not only internationally, but also in New Zealand and Australia, and attract a cohort of Pacific researchers. That excites me, that we have the opportunity to develop a talent pool of Pacific researchers, and working alongside the likes of the Compass team, Maurice Wilkins Centre team, Nikki Moreland's team, primary health care team, because this centre comes under the Tongan Health Society, an integrated primary healthcare service, which comes under the only Pacific-led primary health organization in New Zealand. And I want to acknowledge Dr. Anai, who is the clinical director at the Cause Collective. And so the opportunity to bring Pacific communities to meet the researchers we work with is an exciting one for the community, because researchers get to learn about them and vice versa. And when you open those doors for engagement, for relationships, the opportunity for progress, for working together, is just strengthened even more. And that's why it's important for us to be running with champions. And, you know, this is an image from the 2007 Rugby World Cup in Marseille, France. And I see it in our teams, how important it is to have high-performing teams. They work hard, they have a goal. And in the Compass team, I see a transdisciplinary group of people with a common goal, a common purpose. We all want better health and well-being outcomes for our people. And, you know, across all the various conditions that we're working with, our strength is in our people. We can take that strengths-based approach, the values and the richness that we bring to our populations, all of New Zealand. There's so much to learn. And yes, you need a number one prop behind you that can be there for the breakdown, as you see in this image. You know, who is protecting, who the lead is protecting what is precious to us, our data, our people. But I know definitely the one behind is a forward, is a number one prop. And that's my son. He's just left Northland Rugby to coach the Fiji rugby team, and he's taking the Fiji team to Tonga today. And that's how I know. It's his secret, but I just found out because, you know, mums know everything. They will find out eventually. So, you know, that's in a coconut shell, very little. A snapshot of, you know, working with Pacific peoples, researchers, and the joy and excitement because we share something in common. And I look forward to future opportunities to work with you all. Neil, I know you're a trustee of the Fono. Yes, opportunity there to reach out to Fono and Devita and the team. Tom, great to meet you as well. There you are. Yes. And I look forward to the tries we're going to score after this. Malo au Peter.